There's a special service announcement today here in Bensalem, and with it today we have Dr. Wadrow. We're going to talk about the coronavirus, and Doctor, you can give us some advice.
So there's been a lot of discussion and a lot of media about the coronavirus, sometimes called COVID-19. The coronavirus is something that is spread by respiratory droplets, and one of the issues we have with this particular virus is that since it's not been in humans before, there's no immunity. In addition to that, there's no immunization, so it's spreading quite easily. We've seen a lot of patients getting it. In general, the symptoms that people have are a respiratory illness. They usually have a fever, some body aches, a cough. Unfortunately, a small number of patients can go on to have a very serious course, which can include severe pneumonia, and there is some people that can die from it. The most important thing for people to remember is that in order to prevent the spread of it, very simple things can be done. What we are asking people to do is basic social distancing, trying to maintain a distance of 4 to 6 feet between you and other people, especially if that person has a cough or other symptoms of a virus. In addition to that, hand washing. Washing your hands for 20 seconds with soap and water, or using an alcohol-based hand cleaner will also help. Cough hygiene techniques such as coughing into your elbow to avoid coughing into the droplets to allow to spread to other people. What we want people to know is that we can control this by simple hygiene activities, simple social distancing, and most importantly is if you get signs or symptoms of a febrile respiratory illness, stay inside. Don't go out, and if you have to go out, wear a mask to prevent the droplets from spreading. What we know is that if we work together, we can avoid the spread of this, and more importantly, if people stay home, take care of their symptoms, do not call hospitals, call 911 unless it's an emergency. We will be able to get through this, people will do very well, and we will not have this problem going forward if we just follow those simple rules.
Doctor, why are we hearing about large gatherings not having these meetings and the schools being closed? What is that?
Great question, Mr. Mayor. Basically, since this is a droplet-based disease and it's spread by simple things such as people coughing and sneezing, shaking hands, it can be on surfaces. By reducing large groups of people, it reduces the chance that this will be spread amongst many people. As you know, things like the common cold are spread that way. The problem with coronavirus, or COVID-19, is that it is more severe than a common cold, and because of that, we want to reduce that. If we reduce people getting this infection, it will not spread around the population, which will reduce the risk of us having more severe illness in our communities.
Thank you, Doctor, for being here today to give us this information. It will go a long ways with helping people understand the coronavirus and how we can help to alleviate it. So thank you again, and thanks, Jefferson, for all the great work you do with us.
Thank you, Mr. Mayor. I'd shake hands with you, but we're not supposed to right now.
Shake hands.
We've just been trying to get facts out. We don't want people to be afraid. We want them to have facts and be armed with data so they can make good decisions for themselves and their family.